Hello everyone, I am Dr. Rajashekar, Associate Professor of Biochemistry, Manipal Academy of Higher Education. Today's topic for video lecture are vitamin K and vitamin E. First, I will take up vitamin K for under the following headings. So, we shall study first the chemical forms and sources of vitamin K, followed by RDA and function of this vitamin. Next, we will discuss the deficiency manifestation and significance of its administration to newborns. And finally, we will discuss regarding vitamin K antagonists, hypervitaminosis. At the end of this video, we will take up some MCQs to revise the topic. Vitamin K is a fat soluble vitamin. In 1930s, Danish scientist Henrik Dam discovered that certain nutrients was essential for proper functioning of blood clotting mechanism, and he termed this nutrient coagulation factor. Today we know it as vitamin K. There are three forms of vitamin K. First, vitamin K1, which is also known as phyloquinone. This is present in plants. Next, we have vitamin K2, which is known as mannaquinone, which is present in animals, and this is synthesized by the intestinal bacteria. The third form of vitamin K is known as vitamin K3, which is also known as mannadione. This is a synthetic form of this vitamin, which is water soluble. Next, we will discuss the sources of vitamin K. Plant sources include green leafy vegetables such as spinach, cabbage, soya beans, etc. Plant sources include egg yolk, organ meat, fish. Please note that vitamin K also synthesized by the intestinal bacteria. In patients who are taking long-term antibiotic therapy, the vitamin K deficiency may occur as antibiotics kill the intestinal bacteria. Next, we shall discuss the RDA, that is daily recommended allowance, which is 70 to 140 micrograms per day. Next, we shall discuss regarding absorption and storage of this vitamin. As vitamin K is fat soluble vitamin, its absorption requires bile salts and it is absorbed in the small intestine, and it is carried from the intestine to the peripheral tissues with the help of chylomicron and stored in the liver. Now, we will discuss regarding function of this vitamin. Vitamin K plays a crucial role in blood coagulation. Blood clotting factors such as prothrombin, factors 7, 9 and 10 are synthesized in liver in inactive form. The activation of these clotting factors require vitamin K dependent carboxylation of several glutamic acid residues on the clotting factors. Since these proteins are synthesized first, followed by modification, we refer this process as post-translation modification of clotting factor. Now, we shall see in little more detail the carboxylation of glutamic acid residues. Here we have the glutamic acid on the clotting factors. Now, in the presence of an enzyme called as gamma glutamyl carboxylase, this glutamic acid will undergo carboxylation reaction, that is carboxyl group is added to this glutamic acid residues. This reaction requires carbon dioxide and oxygen and also requires reduced form of vitamin K, which is also known as hydroquinone. Now, during the process, this hydroquinone gets converted to epoxide form of vitamin K. So, overall this is how inactive clotting factors are carboxylated to form the active clotting factors, which then will involve in the clotting mechanism. Now, this epoxide form of vitamin K will be converted to reduced form of vitamin K with the help of two reactions. First, we have epoxide reductase enzyme, which will convert the epoxide form of vitamin K to the oxidized form of vitamin K or quinone form of the vitamin K. This requires lipoic acid. Next, the oxidized form of vitamin K gets converted to reduced form of vitamin K with the help of enzyme vitamin K reductase. This reaction requires NADPH plus H plus. Now, once we have the reduced form of vitamin K, this can participate in conversion of more molecules of inactive clotting factor into active clotting factor. This cycle is known as vitamin K cycle. Now, there are two compounds, dicumarol and warfarin. They inhibit epoxide reductase enzyme. Now, once the epoxide reductase enzyme is inhibited, there is conversion of epoxide to reduced form of vitamin K is inhibited. This in turn will inhibit the activation of clotting factors. So, these molecules dicumarol and warfarin act as anticoagulants. So, that is regarding the first function of vitamin K. Next, we will move on to we will see the second function of vitamin K, which is again carboxylation of glutamic acid residue on a protein called as osteocalcin. What is this osteocalcin? Osteocalcin is a calcium binding protein present in the bone. The process of carboxylation of glutamic acid residue on this protein helps it to bind it with the calcium molecule. So, this process helps in mineralization of bone. So, to summarize, vitamin K plays a crucial role in blood coagulation process and also formation of bone. Now, we will look at the conditions wherein we find vitamin K deficiency. So, this can be seen in patients with liver disease and biliary obstruction, as there is lack of bile acid secretion in these patients. This can be seen in newborn infants for many reasons. The first one being poor transport of vitamin K across the placenta from the mother to the fetus. The second reason being gut of the newborn infant is sterile and it requires some days for the bacteria to grow and produce vitamin K. The third reason being vitamin K content of the mother's milk is very low. For this reason, newborn infants might suffer from vitamin K deficiency. The third condition in which we can find vitamin deficiency is patients who undergo long-term antibiotic therapy, because antibiotics will kill the intestinal bacteria which generally produce the vitamin K. The fourth condition is with the patient with fat malabsorption syndrome. So, these are the conditions where we find vitamin K deficiency. Next, we shall see the consequences of vitamin K deficiency. So, vitamin K plays a very important role in blood coagulation, that is activation of clotting factors. So, when vitamin K is deficient, there will be lack of active clotting factors, which will result in impaired blood clotting process. This in turn will will bring about prolongation of prothrombin time and delayed clotting time. Deficiency of vitamin K, as I said, can be seen in newborn infants, especially in premature infants. This bleeding disorder in infant is called as vitamin K deficiency bleeding or hemorrhagic disease of newborn. So, Ministry of Health and Family Welfare, Government of India recommends that all the newborns should receive a single dose of vitamin K intramuscularly as a prophylaxis against hemorrhagic disease of newborn. Vitamin K deficiency in children and in adults can manifest as bruising tendency, mucous membrane hemorrhage, nasal bleeding and post-traumatic bleeding. Next, we shall discuss regarding the vitamin K antagonists. There are two compounds, namely decumerol and warfarin, which are vitamin K antagonists. So, warfarin is used as an anticoagulant clinically for preventing thrombosis and embolism in patients who have had myocardial infarction, stroke or heart valve replacement. Next, we have to know about a condition called as fetal warfarin syndrome. This is seen in infants who are born to mothers who are treated with warfarin during pregnancy. This condition is characterized by skeletal abnormalities. So, it's better to avoid warfarin treatment during pregnancy. Finally, we shall discuss about hypervitaminosis of vitamin K. So, administration of large dose of vitamin K can cause breakdown of RBCs resulting in hemolytic anemia and jaundice. So, to summarize, there are three active forms of vitamin K, that is vitamin K1, vitamin K2 which is also known as mannaquinone, which is synthesized by the intestinal bacteria. Then we have the third form, that is called as vitamin K3 or mannadione, which is a synthetic form of vitamin K and which is water soluble. Rich source of vitamin K include green leafy vegetables, and first function of vitamin K is in the blood coagulation process. That is, it is responsible for the activation of blood clotting factors, namely prothrombin, clotting factor 7, 9 and 10. Second function of vitamin K is in the carboxylation of glutamic acid residue in osteocalcin, a protein which is present in the bone, which helps in binding this protein to the calcium. Hence, it helps in the mineralization of bone. Vitamin K deficiency in newborn causes hemorrhagic disease of newborns. Then finally, we looked at vitamin K antagonists. They are decumerol and warfarin, and towards the end we also discussed regarding fetal warfarin syndrome, which is seen in infants born to mothers who are treated with vitamin K antagonists such as warfarin during pregnancy. So, that is regarding vitamin K. Now, we will move on to vitamin E. So, again we will be studying vitamin E from under the following headings. We will discuss the chemical forms of vitamin E, then sources, RDA, functions, then deficiency manifestations, followed by hypervitaminosis of vitamin E. Towards the end of this video, we are going to discuss some MCQs regarding vitamin K as well as vitamin E to revise the topic. Vitamin E is a fat soluble vitamin. When vitamin E was first isolated in 1920s, Researchers found that animals require this substance for normal reproduction, and they call it tocopherol, which means to bear an offspring in Greek. However, today vitamin E is known for its potent antioxidant property. There are many forms of tocopherol. Alpha tocopherol is the most active of them all. Next, we shall discuss the source of vitamin E. Vegetable oil are rich source of vitamin E. Example, wheat germ oil, sunflower oil, soya bean oil, palm oil. Egg yolk and organ meat also contain moderate amount of vitamin E. RDA, that is alpha tocopherol, RDA for alpha tocopherol is 15 milligrams per day for adults. Next, we shall discuss about the absorption. As vitamin K, vitamin E also fat soluble vitamin. So, it requires bile salt for its absorption, and it is transported from the intestine to the peripheral tissues with the help of chylomicron, and it is stored both in adipose tissue as well as in the liver. Next, we will discuss the functions of vitamin E. The first function of vitamin E as an antioxidant. Vitamin E is a membrane bound natural antioxidant, and it is a chain breaking antioxidant and prevents the lipid peroxidation in cell membrane. By doing this, it helps to maintain the fluidity of cell membrane, protects the RBC from hemolysis. It also helps to keep the structural and functional integrity of all the cells, reduces the risk of atherosclerosis by preventing the oxidation of LDL, and finally, it plays a central role in maintaining neurological structure and function. All these functions are attributed to the antioxidant property of vitamin E. Second function, vitamin E is also involved in reproduction. Early studies of induced vitamin E deficiencies in laboratory animals resulted in infertility. This indicates that vitamin E may have a role in reproduction. There is a close interrelationship of vitamin E with selenium. So, if you have sufficient quantity of selenium in the cell, the requirement of vitamin E decreases. Why it is so? So, selenium is a mineral present in an antioxidant enzyme called as glutathione peroxidase. Glutathione peroxidase is responsible for neutralization of hydrogen peroxide. So, selenium acts synergistically with vitamin E to minimize the lipid peroxidation of cell membrane. So, selenium has found to decrease the requirement of vitamin E. Next, we shall discuss regarding vitamin E deficiency. Vitamin E deficiency are rare, but can be seen in patients with severe fat malabsorption, in patients with cystic fibrosis, wherein there is a lack of lack of digestive secretions. Thirdly, vitamin E deficiency also can be found in premature infants, and finally, it can be found in a condition called as A beta lipoproteinemias, which involves defective chylomicron synthesis. Vitamin E deficiency causes neurological problems such as spinocerebellar ataxia, retinopathy, peripheral neuropathy due to poor nerve conduction, and also can cause anemia due to oxidative damage to the red blood cells. hypervitaminosis of E. Large dose of vitamin E, that is 300 milligrams per day, may cause tendency to hemorrhage as it acts as a mild anticoagulant. So, to summarize, the alpha tocopherol is the active form of vitamin E, and vegetable oil are a rich source of vitamin E. The first important function of vitamin E is as an antioxidant. Vitamin E is a cell membrane bound antioxidant and which helps to prevent the lipid peroxidation of cell membrane. By doing this, it helps to maintain the fluidity of the cell membrane. It prevents the hemolysis of RBCs. It also decreases the chances of atherosclerosis by preventing lipid peroxidation of LDL. Finally, vitamin E is also responsible for the structural and functional integrity of nervous tissue. Vitamin E is also involved in reproduction. Vitamin E deficiencies are rare, but can cause, if it is there is a vitamin deficiency, can result in neurological disorders and as well as anemia. So, that is regarding vitamin E. Now, we shall take up some MCQ questions to discuss these two topics. Here is the first MCQ. Vitamin K is involved in carboxylation of which of the following amino acid residue on the prothrombin? Options are A. Lysine, B. Proline, C. Glutamate, D. Glutamine. As we know, it is a glutamate which undergoes gamma carboxylation on the clotting factors. So, the correct answer is C, glutamate. Here is the second MCQ. Vitamin K is involved in carboxylation of glutamic acid residue in which of the following proteins? Options are A. Collagen, B. Osteocalcin, C. Epoxide reductase, D. Vitamin K reductase. So, as we know, vitamin K is involved in carboxylation of glutamic acid residue mainly in two proteins. One is clotting factor, second is osteocalcin. Here, since the option given is osteocalcin, that is the answer. So, answer B is the osteocalcin is the answer for this. So, osteocalcin is a protein present in bone which undergoes this carboxylation reaction, and that helps the osteocalcin to bind with the calcium. Here is the next question. The activation of clotting factors by vitamin K is an example for which of the following processes? The options are A. Post transcription modification, B. Post translational modification, C. Phosphorylation, D. Glycosylation. As we know, the clotting factor undergo modification once they are synthesized, but they do not undergo phosphorylation, either phosphorylation or glycosylation. They undergo gamma carboxylation. So, the answer B is the correct choice. They undergo post translational modification. Here we have the last MCQ. Which of the following minerals has a synergistic antioxidant action with vitamin E? Options are calcium, iodine, magnesium, selenium. So, the answer is selenium, because selenium is present with an antioxidant enzyme called as glutathione peroxidase, which help to neutralize the hydrogen peroxide. So, selenium along with vitamin E helps in the antioxidant action and neutralizes the free radical. So, the answer for this is D. So, that completes the topic for this video. Here are my references. Thank you.